Hi, we're moving.
Hello.
And Cale doesn't feel good, so I have Nick here.
Cale feels not good.
Cale feels not good.
I'm Nick.
This is Nick. You want to do that again?
I thought that was perfect. I feel not good.
Cale feels not good, so
Yeah.
he's over there. Anyway, so today we're talking about a hot topic about Dwayne Wade, who apparently formerly played for the Miami Heat. I don't know, we don't follow sports ball. So he played basketball, and recently his 12-year-old came out as trans, and the whole internet is freaking out, saying that this kid's gonna have surgery and all this type of stuff, and we're here to be like, nah, that's not happening. And tell you what exactly the transitioning process could look like at this point in this 12-year-old's life.
Imagine that, the internet overreacting.
Yeah, I know. First of all, Dwayne Wade says that Zaya, which is the trans kid's name that they have chosen to go by, says that she's known that she is trans since she was 3, which a lot of people say is not possible. But people start figuring out their gender, specifically like kids, they're figuring out like what things are, the you show me mine, I show you yours type thing. And they're figuring out what the difference is between genders. So a lot of kids start figuring out their gender identity around 4 or 5 years old, or they can start figuring out as early as that, just because that's when you start kind of figuring out like how kids are treated differently based on like different stereotypes and things.
And parents be pushing that shit on their kids anyway.
Yeah. So like, you know, from a young age, especially in the U.S., they like pink is for girls, blue is for boys, and they have the whole girls can do this thing, boys can do this thing. Penny's playing with bags.
Yeah, it's really annoying.
Is a disaster. So kids start figuring out what they like to do, and they start figuring out what the expected roles of genders are pretty early, just because that's just when they start figuring things out. And some kids don't question it, but some kids do, and that's perfectly fine. So with Dwayne Wade saying that she's known since she was very small, that's entirely possible. It's not like you just kind of figure it out the moment you turn, or like you hit the puberty area. Like, some people do.
It's just case by case?
It is case by case. Everything's case by case. With them recently telling everybody that she is trans, there has been some backlash. Boozy Badass talked about, or like posted a video talking about how, of course, he misgendered her the entire time.
Which is disrespectful.
Yeah, Badass made a video talking about how the parents are going too far, and even said, don't chop his dick off. Which, first of all, whoa!
What? Has Dwayne Wade even said what they were gonna do?
Oh, no, they've talked about, like, they're not pursuing anything medical this time.
Like, I don't understand.
Because everyone's freaking out, because panicking about trans people is a way to distract themselves. It's so very frustrating.
Yeah.
Because, yeah.
So they don't even recommend HRT until you're at least 16 years old, so...
At least around that age.
Yeah.
Yeah, but that's after, so... First of all...
HRT, hormone replacement therapy.
Yes. He also said that because she's only 12 years old, she's unable to make personal decisions. First of all, you don't have to transition medically to be trans. You don't have to do that, because some people can't physically take hormone replacement therapy. Some people don't have access to those kind of doctors, depending on where they live and that kind of thing. So...
Even if they did... They can still present however they want.
Yeah.
And still be trans.
Yeah. Also, medical treatment is expensive.
Yes.
For everybody.
Yeah.
The most that can honestly be done for Zaya at this point is people can use the right pronouns for her, and she can go by the right name that she wants, and she can dress more femininely, and depending on where she's at, which of course would be determined by an endocrinologist, at 12 years old, she could, in theory, start puberty blockers. Which puberty blockers basically just press like a pause button on puberty to prevent any permanent physical, biological changes from happening. For her, it would be the sharpening of her jawline and
lowering of your voice.
Yes, because those are permanent changes that would have to be altered with surgery after. Like, it would prevent an Adam's apple. Yeah.
I don't have much of one, but it's there.
Mine's here somewhere. Got a tiny one. Puberty blockers would block either testosterone or estrogen, depending on what gender or sex was assigned at birth. AMAB, or assigned male at birth people, it would block the production of testosterone, and then vice versa. There are two kinds of puberty blockers. There's Histrelin, which is it's kind of a rod that they insert under your skin of your arm, kind of like the birth control one that is commonly known about. There's also leprolide acetate. I hope I said that right. It's a shot version.
Who names these things?
Doctors, probably. Pharmacists? I don't know. Pharmaceutical companies. So it's a shot that either lasts for 1, 3, or 4 months, depending on how long you want to do it. And as far as we know, there's no, like, overarching damaging effects. They just started doing this to treat trans kids starting in 2007 in Massachusetts at the Boston Children's Hospital. And then later, the Endocrine Society, which is a organization of endocrinologists, later recommended this treatment for trans kids starting in 2009 because it prevents that changes that are permanent and would have to be altered later, like with intensive surgeries that are a pain and expensive.
Yeah, so the thought is to try to pause it before you have to go back and try to fix something later, which is like even more expensive and possibly more damaging to your body.
It's more psychologically damaging as well because you're having to go through that puberty and with
the wrong puberty.
The wrong puberty, which is...
Or whatever doesn't feel right for you. It's
not even just uncomfortable. It's just like you hate this. You hate your body and the way that it's developing, and you can't change it. And it doesn't fit with the way that you identify, so that it can be extremely psychologically damaging.
So using those blockers can help prevent dysphoria and depression that is very, very common with trans youth.
Yes, it is super common. With the non-acceptance of the trans identity for kids. So this dude named Russell, or last name Russell, from the University of Texas, had former research that 1 in 3 transgender kids has thought about suicide, which is double the rate of a cisgender kid. Compared with peers who could not use their chosen name in any context, young people who could use their name in all 4 areas, school, home, work, and with friends, experienced 71% fewer symptoms of severe depression, 34% decrease in reported thoughts of suicide, and a 65% decrease in suicidal attempts. And that's with a population that 50% attempt suicide by age 20.
Yeah.
The Endocrine Society doesn't recommend starting even puberty blockers until the ages of 10 and 12, which is called the Tanner Stage 2 developmental stage. And then the desired hormones would possibly be starting slowly at 16 so that you can have the puberty that you are aiming for. She also can't really get a lot of like a genital reconstruction surgery, which everyone's freaking out about, at least until maybe 17, maybe 16. The only person that comes to mind when you talk about genital reconstruction that young is Jazz Jennings, who is another very well-known trans activist. She's 19 now, I believe. But that's the only person that I can really think of that has had it. It's very, very uncommon for that to happen because, of course, you have to have parental permission and it's a whole thing. There's so much else that goes into it. Before they're even given hormones at that age, if they decide to go through with getting HRT, there's a lot of counseling, there's a lot of therapy, there's a lot of figuring out how solid they are in that identity before they're even allowed to start doing anything.
I mean, you had to go through, I mean, at your age, how old were you?
I was 19?
Yeah, and
Yeah,
you still had to go through a bunch of stuff to like convince doctors that you were ready or whatever.
But in the state of Georgia, you have to have a letter from a therapist stating that you're like in a mental capacity to receive hormone therapy. Yeah, I went to the informed consent clinic, which basically I went in and I was like, hey, I'll know what this does to me. And they were like, yeah, okay. And they did my blood work. They made sure I was physically able to do it because some people can't, depending on other medical conditions or things like that. And then they started me off. The program later tanked a month or two later. And then I just kind of had to figure it out from there. It's complicated. Having to prove that you're trans enough to a therapist is frustrating.
Yeah, because you're already having to prove to people around you that you're trans enough or whatever.
Yeah.
I think the problem with a lot of these people complaining on the internet, even if they did understand that these surgeries and stuff can't even happen yet, it's really just the fact that the parents are being supportive of their child being trans. I think that's even like the bottom line. Even if they knew that the surgeries wouldn't even happen or whatever.
Oh yeah,
it's just the fact that they're being supportive and people aren't okay with that.
They're just upset that this like can be allowed by somebody. Yeah. But overall, the support for Zaya that I have found while researching this topic has been very positive, of course, because it should be. And a lot of people came to the defense of Zaya and her family when these people attacked them on the internet. Yeah.
All this to say that all those reactions on the internet, it's just pointless.
They're misinformed.
Yes.
It's creating this fear towards trans people and towards the community that is completely false. Just let them be who they are. If they say that their name is different and that they want to, or they are a girl, roll with it. If they change their mind later, whatever. That doesn't matter. At least you supported them in it. So, hopefully that answered all the questions that you have around the situation with Zaya and Dwayne Wade.
If you have more, you can always comment.
Or send us a message on any of our social media, and we can hopefully answer your questions as best as we can.
We'll try, because we don't know everything.
We don't know everything, and if we're not, we'll Google it. Also, if you like this, leave a like. If you enjoyed it, and please subscribe for more videos to come. We're moving, so bear with us. We'll figure it out. But, bye.